name is Ricky Henry Grant, and I'm an in-house clinical research associate for a company called Seniors Health, and they are a contract research organisation. I was brought up in Belgium and I went to school there, and I loved science. So I did a biomedical science degree. I graduated with a Masters of Research in Biomedical Sciences in 2015. I mainly did the degree because I did enjoy initially working in the lab. So it was mainly working in the lab, and then obviously I had lectures as well, but the main part was actually having my own project, which was on pancreatic cancer cells, where I used a combination treatment to analyse the cell death of those cells. After my masters, I then was given an opportunity to carry on the project and work as a research assistant for 1 year, where I continued my project, and in the end I was able to even publish a paper with my supervisor, which was quite great. As I said, I've always liked nature or science, and I was really good in biology at school. My teacher told me, and I always had good grades in science at school, so that's how I then decided to go on to actually apply from Belgium to England for biomedical sciences. So it wasn't an easy process at all. I was brought up bilingual, but everything at school was in German, so I was used to having all the lectures in German, no English at all. So coming to England to do my bachelor's, it was very, very, very daunting. Like, it was quite difficult. So I was in lectures writing notes in German. It took quite a while for me to adapt. I believe there was one time where I spoke to one of my friends at university where they had gone into looking for an internship whilst they were doing their bachelor's, and I realised, okay, you're doing your degree, but very important is experience as well. So I then ended up contacting one of our lecturers at the university to ask her if she would be happy with me being working in their lab as an intern, even if they wouldn't pay me, I would still be happy. It was quite great. So I was working part-time it was basically research assistant, intern. Had my first project, that's where it started, in pancreatic cancer cells. That's why after my internship, I then was so lucky to find a project in my Masters of Research, which was also in pancreatic cancer cells. So that's where my passion then carried on for cancer research. It was another aspect which allowed me to gain some insight of charity for cancer research projects. I was a volunteer for a charity called Copperfield with my friends for I think it was 2 months during the summer period. So we raised awareness of breast cancer. That was quite great as well. It's a nice experience, and it's always good to add to your CV. I would say get experience in an area where you might end up working in, and also get experience as if you're really passionate about raising awareness or getting money for charity in. So it's quite great. It's a nice experience. You get to know new people, and you understand bit more of the aspect of the patient side. So you hear stories about people having that illness, and then it's motivating. Okay, so after completing my research assistant position, I did some research because I needed a new job, and then found this CTA job, which is a clinical trials assistant job at a CRO, which is a smaller CRO based in London, Richmond Pharmacology. I worked as a clinical trials assistant for one year, and then after that I was promoted to ward supervisor or supervisor of the junior clinical trials assistants. That was a great exposure, my first exposure to clinical research. After working as a supervisor for the junior CTAs, I was then promoted even more as an associate clinical quality manager. I did the associate clinical quality manager position for 4 months, and then I decided to go on to actually get some experience as a monitor, and also be able to use my language skills because I can speak fluent German, where I then bumped onto the position of an in-house CRA, which is an in-house clinical research associate. So I find it's very important to know that whilst you're actually doing your degree, to go out of your way, not to just look for a job, for example, to make money, to look for a job that will help you in the long run, to actually get some experience in the area that you find interest, and it's a bonus if you're even able to make some money on the side. You were studying at the time being now, I would tell you to reach out to contract research organizations or even pharmaceutical companies to ask for a CTA position to get that experience and that foot into the company or into the industry. And even an apprenticeship, that would be great as well. So my company now, they have started apprenticeships, where we get students now that are actually assisting us as the in-house clinical research associate.